Typical thoracic vertebra. The second to 8th are the typical thoracic vertebra, and 1, 9, 10, 11, 12 are atypical. Now, typical thoracic vertebra has a body, transverse process, spinous process, lamina. Now the body is heart shaped. The anteroposterior diameter and the transverse diameter are almost equal, and attachments in the anterior part there is anterior longitudinal ligament, posterior there is posterior longitudinal ligament, and then in the lamina there is attachment of ligamentum flava. Now this is the superior articular process which is present on the upper part of the lamina, and this is the inferior articular facet. Now the superior articular facet forms an arch like this, which provides rotatory movements to the whole vertebral column, and this inferior articular facet articulates with the upper superior articular facet with the of the lower vertebra, and the superior articular facet articulates with the corresponding upper vertebra. Now, how can we identify the thoracic vertebra from other vertebrae? There is in the body there is presence of two articular facets on demifacets, superior demifacet, inferior demifacet. Now, how it articulates with the rib? This is a rib. Now, the rib has a upper smaller articular facet and lower larger articular facet. The lower larger articular facet articulates with the superior articular facet of the superior demifacet of the corresponding vertebra, numerically corresponding vertebra, and the upper smaller facet on the rib articulates with the numerically corresponding vertebra of the upper vertebra.
Okay.
Now, transverse facet also has two articular facet, which is concave shaped in thoracic 1 to thoracic 6 vertebra, and it is flattened in thoracic 7 to thoracic 10, and in thoracic 11 and 12 it is absent. Now, how it articulates? It articulates with the rib, with the facet on the rib, which is present on the junction between the neck and the shaft. There is a facet on the rib. It articulates with the transverse facet like this and forms a costotransverse joint. Now, in the crest, it articulates by superior costotransverse ligament, in the lateral portion by lateral costotransverse ligament, and in between them in the inferior portion by the inferior costotransverse ligament. Now, this is the articular notch, superior articular notch and inferior articular notch. Superior articular notch is more shallower than the inferior articular notch. Now, this inferior articular notch articulates with the corresponding lower vertebra like this and forms a foramen. This is the intervertebral foramen through which spinal nerve passes. And inside there is a foramen, this foramen.
कौन सा?
This inside foramen, this foramen, ये अंदर जो foramen है ना, ये वाला जो foramen दिख रहा है अंदर, through that basivertebral veins passes.
Right.
Now the foramen is present here in the body, this foramen through which the basivertebral veins passes.